Imagine a newborn llama, full of life, looks totally healthy. But inside, there's this hidden genetic issue, almost like a ticking clock that's eventually going to cause major problems. That's sort of the tragic picture with Juvenile Llama Immunodeficiency Syndrome, or JLIDS. It's a really unique and devastating condition. So, our mission today is really to unpack the information you've shared with us to give you a clear picture of what this rare genetic condition is all about. It affects young llamas, crias. We want to explore, what causes it, how it actually impacts the animals, and what makes it different, especially if we try to compare it to, say, issues in deer. It's kind of like a medical mystery we're trying to solve together. Okay, so to really get a handle on JLIDS, let's start with the basics. What exactly is it? You said it's a rare immunodeficiency in young llamas, the crias, and it messes up their immune system pretty badly, right? It makes them prone to infections, struggle to grow.
That's exactly right. And it's progressive, so it gets worse over time. Sadly, it's fatal and it's inherited. What's really striking, like you mentioned, is that these affected crias, they often look perfectly fine when they're born.
Okay.
They actually get a bit of a head start because they receive passive immunity from their mother's first milk, the colostrum.
Okay, that makes sense.
But as those maternal antibodies naturally decrease, which usually happens between 2 and 6 months old, that's when you really start to see the signs of JLIs showing up.
That initial period of health must make it so much harder. So if they seem okay at first, is there any hint earlier on, or is it really just watching and waiting for those antibodies to go away? That sounds incredibly difficult for breeders.
It really is a huge challenge for spotting it early. Because their own immune system isn't working properly, you only see the problem once that temporary protection from the mother is gone. So yes, often it is a case of waiting for symptoms. And that leads us to, well, the genetics behind it, which is where things get really specific.
Okay, this is the part that really gets me. It's not just some random sickness. It's a specific genetic fault line, isn't it? Can you walk us through how it's passed down?
Yeah, certainly. It follows what's called an autosomal recessive inheritance pattern.
Okay. Autosomal recessive, what does that mean in practice?
It means that for a cricia to actually get JLIDAS, it has to inherit one copy of the faulty gene from its father, the sire, and one copy from its mother, the dam.
Both parents.
Both parents, exactly. Now, if a llama inherits only one copy of the gene, it's what we call a carrier. They look perfectly healthy, show no signs of the disease at all.
But they can pass it on.
Exactly. They can pass that hidden gene to their own offspring. So think about the probabilities. If you breed two carriers together, it breaks down like this. There's a 25% chance, 1 of 4, that the baby gets two normal genes. That one's healthy, not a carrier. There's a 50% chance, so half the time, the baby gets one normal and one faulty gene. It'll be a carrier, just like the parents, but healthy itself. And then, the tough one. There's that 25% chance the baby inherits 2 copies of the faulty gene. And that's the crachia that will be affected by JLID.
Wow, those odds. And the really difficult part you mentioned is that the specific gene causing all this hasn't actually been pinned down yet.
That's correct.
Which must make it impossible, or nearly impossible, to develop a straightforward test to screen for carriers. It feels like knowing something's wrong with the wiring, but you can't find the exact faulty wire.
That's a very good analogy.
Yeah.
Precisely. And that lack of a test makes prevention much harder. So, to understand how the immune system actually fails, we need to look at what's happening inside. It's fundamentally a severe B-cell immunodeficiency.
B cells, those are the antibody factors, right?
Exactly. B cells are a type of white blood cell, and they're absolutely essential for making antibodies. You might know them as immunoglobulins, things like IgG, IgM, IgA. Think of antibodies as the body's, it's scouts and soldiers. They identify and tag or neutralize invaders like bacteria and viruses. Now, in llamas with JLIDs, these crucial B cells just don't mature the way they're supposed to. Instead, they undergo something called apoptosis that's programmed cell death way too early.
So they basically self-destruct before they can do their job.
In essence, yes. And the result is this profound lack, almost a complete absence, of all the different types of antibodies.
So without those antibodies, the young llama, once the mother's protection fades, is just wide open to attack from anything in the environment. What's interesting, though, is you said their T-cell function seems okay. T-cells are another part of the immune system.
That's right. Their T-cell-mediated immunity appears largely normal.
What does that really tell us? Does it highlight just how vital those B cells and antibodies are for llamas specifically? Are there ideas why that part fails?
It really underscores how different parts of the immune system have specialized jobs and how much they rely on each other. T cells are great at handling certain things, like cells infected with viruses or some fungi, but they just can't make up for having no antibodies to fight off common bacteria or neutralize viruses floating around outside the cells. Antibodies are critical for that first line of defense against so many everyday pathogens.
Makes sense.
As for why the B cells fail, well, that circles back to the unknown gene. Finding that gene is the key to understanding the exact molecular pathway that's disrupted. Research is ongoing, but it's complex. And this lack of defense leads to some very clear signs, usually showing up, like we said, between 2 and 6 months. The most consistent thing we see is failure to thrive.
Meaning they just don't grow properly.
Exactly. They show poor growth, they lose weight, they often look stunted or just generally unthrifty compared to other crias their age. And then, because they have no real antibody defense, you see recurrent infections. Just one thing after another.
What kind of infections are we talking about?
All sorts, really. Persistent bacterial, viral, fungal infections. It can show up as respiratory problems like constant coughing, nasal discharge, even pneumonia, or digestive issues. Chronic diarrhea is common, leading to more weight loss. Skin infections are also frequent, like dermatitis or abscesses that just won't heal properly. And sometimes it's even worse. Systemic infections, sepsis, where the infection gets into the bloodstream. That causes fever, extreme lethargy, sometimes collapse, just general wasting, maybe a rough-looking fleece, low energy. It's a whole constellation of problems stemming from that faulty immune system.
It sounds absolutely heartbreaking. And you stressed it's progressive. So even if you treat, say, a bout of pneumonia, the underlying problem is still there and something else is likely around the corner. Do they ever get better, even for a little while?
Unfortunately, significant lasting improvements are very, very rare. You might manage one infection with, strong antibiotics and see a temporary pickup.
A brief respite, maybe?
Maybe. But because their immune system isn't working, they're incredibly vulnerable. It's like trying to patch leaks in a dam that's fundamentally flawed.
Yeah.
The prognosis is, frankly, grim. These crias usually succumb to one of these opportunistic infections because their bodies just can't fight back. Long-term survival really isn't expected. Most affected crias will sadly die or reach a point where humane euthanasia is the kindest option, usually by the time they're 6 to 8 months old. It's a very tough reality.
So, given those symptoms, the failure to thrive, the constant infections in a young cria, how does a vet actually confirm definitively that it is JLIs?
Well, that clinical picture is usually what raises suspicion first. A vet sees that pattern in a cria of the right age range, and JLIDs becomes a strong possibility. That's the presumptive diagnosis.
Okay.
But to confirm it, you need more. A detailed clinical history is important, tracking those recurring infections, the poor growth. Then you move to lab tests. Blood work, or hematology, often shows persistent lymphopenia. That's a low count of lymphocytes, a type of white blood cell. That's a key clue.
Lymphopenia? Okay.
You might also see signs of anemia or chronic inflammation in the blood tests. But the really crucial test, the definitive one, is measuring their immunoglobulin levels, specifically IgG.
Ah, the antibodies themselves.
Exactly. In a cria with JLIDs, once those maternal antibodies are gone, their own IgG levels will be incredibly low, sometimes practically non-existent. That's a hallmark finding.
Makes sense. Any other tests?
Flow cytometry can sometimes be used. It's a more specialized test that looks at the different types of lymphocytes, confirming that lack of B cells. And then, sadly, if the animal does pass away, a postmortem exam, a necropsy, provides final confirmation. It will show underdeveloped lymphoid tissues, the lymph nodes, the spleen, which are basically the immune system's headquarters. Their underdevelopment reflects that profound immunodeficiency. Now, this next point is incredibly important, maybe the most critical thing for owners to understand. There's no cure for JLIDs.
No cure at all.
None. So any treatment we talk about is purely supportive care. It's all focused on managing the symptoms, fighting the current infection, and trying to prevent suffering.
That's vital for people to grasp, isn't it? These efforts, however intensive, are palliative. They won't change the ultimate outcome, unfortunately. It really underscores the gravity of the diagnosis.
Absolutely. So management strategies, they involve things like aggressive antibiotic therapy, using broad-spectrum antibiotics quickly when a bacterial infection pops up.
But the response might not be great.
Often it's poor or short-lived because the underlying immune defect is still there. Another option is plasma transfusions.
Giving them plasma from a healthy llama?
Yes, from a healthy adult. That plasma contains antibodies, so it provides a temporary boost to help fight an active infection. But it's like borrowing immunity. It doesn't last, and it's not a long-term fix.
Right.
Good nutritional support is also key. A high-quality, easy-to-digest diet, sometimes even needing supplemental feeding with a tube, just to fight the wasting. And trying to provide a really clean, dry, low-stress environment helps reduce their exposure to potential germs.
Minimizing challenges.
Exactly. But even with all that, because the prognosis is so poor and there's a high likelihood of ongoing suffering, discussing humane euthanasia with a veterinarian is a really important, though difficult, part of the management plan. It has to be considered once the diagnosis is clear and the curia's quality of life declines.
It's a harsh reality. So if there's no cure and management is just about easing symptoms, then the only real answer has to be prevention, doesn't it?
That's absolutely right. Prevention through responsible breeding is the only way forward with JLIs.
Yeah.
That's the key takeaway here.
So what does responsible breeding look like in this context? How do breeders prevent it?
It starts with meticulous pedigree analysis, knowing the family history of your animals. If a particular llama, male or female, have ever produced a cria diagnosed with JLIs, then that animal is a confirmed carrier. There's no doubt. And therefore, both the sire and the dam of that affected cria are also confirmed or obligate carriers. They both had to contribute the faulty gene. This leads to the most critical step. Do not breed known carriers. Any llama confirmed to have produced a JLIdo cria needs to be removed from the breeding program, period.
That sounds straightforward, but maybe difficult in practice for breeders.
It can be, especially with valuable animals, but it's essential. Also, the parents and the full siblings of an affected cria have a very high chance of being carriers themselves. So breeding them is also extremely risky and generally advised against.
Okay.
Seeking advice can help too. Genetic counseling, talking to a vet or a geneticist who specializes in camelids like llamas and alpacas, can really help breeders make informed, responsible choices. Until we get that specific genetic marker identified and have a reliable screening test, really good record keeping, knowing your pedigrees, and having the discipline to not breed known or suspected carriers, that's our best defense against JLI deaths right now. It's about protecting the future health of the llama population.
That makes complete sense. Now, I'm curious about comparisons. You hear about immune issues in other animals. What about deer, for instance? Do Cervidae, the deer family, have anything like JLIs?
That's a really interesting question, actually. And the answer is, based on current knowledge, no. There is no documented equivalent syndrome specifically identified as JLIs in any deer species.
Really? So nothing quite like this inherited B-cell failure?
Not that's been identified as a specific primary inherited syndrome like JLI-10s. Now, that doesn't mean deer never have immune problems. They absolutely can suffer from immunodeficiency.
But the cause is different.
Yes, typically it's secondary immunodeficiency in deer. It's usually caused by other factors impacting their health. For example, things like severe nutritional deficiencies, maybe a really heavy load of parasites, chronic stress. You sometimes hear about capsular myopathy, which involves extreme stress or even exposure to certain toxins or pollutants in their environment.
Ah, I see. So those external factors can weaken their immune system.
Exactly. They can suppress immune function, making the deer more susceptible to infections, leading to poor growth, weight loss, symptoms that might superficially resemble JLIs in some ways.
But the crucial difference is the root cause. In deer, it's usually something acquired, something environmental or physiological stress-related, not this specific inherited genetic defect causing primary B-cell failure like we see in llamas with JLIs.
Precisely. The underlying mechanism is fundamentally different. JLIs is a distinct inherited entity specific to llamas, as far as we know.
So wrapping this up, our deep dive really highlights JLIs as this very specific inherited and tragically fatal immunodeficiency in young llamas. There's no cure, so everything hinges on prevention through incredibly careful and responsible breeding choices.
That's the core message, yes. It's a stark reminder of the power of genetics.
And thinking beyond just llamas, what does a condition like JLIs make you consider? What are the broader implications, maybe?
Well, it really makes you think, doesn't it? About the responsibilities that come with animal breeding in general, about genetic health across the board. Even with rare conditions like this, it highlights how critical understanding genetics is for animal welfare. How do we approach genetic stewardship ethically? How does knowing about something like JLIDS inform how we care for animals, how we manage genetic diversity, and how we take responsibility for the genetic legacy we shape in all species, not just llamas? It connects back to fundamental questions about our relationship with the animals we care for.